Okay, so we left off, we talked about egg and sperm donation. We'll talk briefly about embryo donation. Embryo donation is exactly what it sounds like. It's acquiring an embryo that has been donated from another couple or individual who is done building their family typically. And instead of discarding or donating their excess embryos to science, for example, they might donate them to an embryo donation agency that then matches that embryo to interested recipients. Embryo donation carries about a 40 to 50% chance of success. It does have a lower cost than egg donation alone. One of the biggest hangups for both recipients, I think really more for donors, when deciding how to what the disposition of their excess embryo should be. Some people find the idea of having siblings that are out there that are their child siblings that are being raised by somebody else. Some people, they have a hard time overcoming that. Some people don't. But the biologic sibling is something that, something that some people get hung up on, and that's why they elect not to donate their embryos and instead discard them or donate them to science. The process is treated similarly to an FET. These embryos are frozen and they're essentially shipped to the clinic of the recipient's desire. And then the FET prep is done similar to how was discussed previously, in which the recipient takes estrogen for 2 weeks, comes in for an ultrasound and progesterone level to make sure the lining is appropriately thickened and the patient is not ovulated, and then they start progesterone injections, continue the estrogen preparation, and then have a transfer of the embryo 3 to 5 days later, depending on the stage at which the embryo was frozen. A couple points. One, if you were to Google embryo donation, you'll see a lot of agencies that traffic in embryo donation spaces, and you'll also see some agencies that term themselves as embryo adoption agencies. And at a quick glance, they're equivalent services, seemingly, but oftentimes they're not equivalent, because embryo adoption agencies may require the same processes that any adoption of a living child would require, like home visits, judicial reviews. There might be some regulations as to who can acquire those embryos. For example, same-sex female couples, same-sex male couples may be excluded. Single women may be excluded. Single men, couples of individuals of a certain age, like if you're above the age of 45. So it's important, if you are interested in embryos from an agency that is advertising embryo adoption, there may be additional burdens on the recipient to acquire those embryos. And it's to the point where the American Society of Reproductive Medicine actually has written a committee opinion about it, and it's shown here, defining embryo donation and ethics committee opinion. And if you're interested, you can read more about it at their website, where they have all these documents. But this paragraph kind of summarizes the salient points. So I'll let you read that on your own. If you want, you can go to the website. It's up here under this URL up here at the top. You could also just Google ASRM Practice Committee, and you can go to news and publications, and you can see all these documents. So just a helpful resource if you want to read more on your own. The process also is involved. It's a little bit more than I want these embryos, let's go ahead and transfer them. It requires psychosocial counseling for both parties, donor and recipients. It requires a legal contract, and then it requires what's called a 3-month cool off, where all parties kind of take 3 months off after everything is complete. And then after that 3-month period, everyone's like, okay, are we cool doing this? Yes, let's move forward. Because some people might have second thoughts about it and decide not to. Rare, but something to guard against.